Tina. Hi, Dr. Abhay. How are you doing?
Yes, so good afternoon, Luke. I'm fine.
Who's joined today. Thank you so much for making time. I know how busy you are with your patients, but we really wanted to address the role of homeopathy in PCOD because this is becoming a huge issue with young teenage girls. And unfortunately, a lot of them go on to live with this in their early 20s and in their late 20s as well. What we are seeing is, the most common thing is an OCP, an oral contraceptive, and all of that stuff, which I honestly have nothing against. But the problem is the side effects in the long run and the fact that we're not addressing the root cause of, what is causing their hormonal imbalance in the first place. So as, our observations have, been definitely lifestyle related, the increase in junk food, sugar, lack of sleep, the stress that teenagers go through, especially girls. Number one, they're going through body changes. Number two, they have their peer pressure. And all of that is adding up to an entire hormonal imbalance. We are seeing the impact of the environment as well, on PCOD, in schools and colleges and all of that stuff. We're seeing weight gain in young girls also creating a problem. Young girls putting on a lot of belly fat, abdominal fat, also leading to a hormonal imbalance. And in turn, they lose their hair, they have acne, skin problems, and that stresses them more because, they want to look good, they want to look pretty and all of that stuff, which is every girl's right. But then this vicious cycle of stress, again, which is the main cause of PCOD, is difficult for them to get out of, So Dr. Abhay, in your experience as a doctor, in layman terms, can you explain to all our listeners exactly what PCOD is, PCOS is, what you see as the main causes of this, and how homeopathy can play a role in this, please?
Yes, so Luke, you've absolutely nailed it right. So basically, what I want everyone to understand here is that PCOS or PCOD nowadays we consider both together because there are a lot of cases where already when we see them, already a lot of structural changes have happened. So PCOS is a metabolic disorder to begin with, and you've already nailed it absolutely where you've said that lifestyle choices that a woman makes make a very, very big difference in the whole outcome of the problem and in the way in which we can handle this issue. Because this, the lifestyle choices that a woman makes in terms of food, in terms of sleep, in terms of exercise, and all these things together determine how difficult or how easy it would be for her to get off the conventional OC pills and all the other things. So what generally happens in PCOS is that there is an increase in the male hormones in women. So the androgens that are the male hormones, they increase. And as a result of which there is a significant decrease in the female hormones also. And that begins the vicious cycle where you can have things like insulin resistance. The body stops responding to insulin, and as a result of that, there is excessive glucose which needs to be managed. There's excessive glucose in the blood. So this is a kind of vicious cycle that a woman enters into. Now, what happens is that excessive androgens can lead to failure in ovulation. So a woman will not ovulate every month, which is very, very essential for her if she has to get a proper cycle. So all these things together happening one after the another or being interlinked is what PCOS is. And as you rightly said, we need to have a holistic approach to try and manage this because there's not one cause that we can actually pinpoint. It can be multiple reasons. Stress, like you said, nowadays our young girls and women are subject to a lot of stress. Now what stress does is in fact releases cortisol and the stress hormones. So when there is increase in the circulating cortisol levels, what will happen is automatically, along with that, if there is insulin resistance, automatically the body will have a tendency to store more fat, and essentially this fat gets stored around their belly. So that is one of the reasons why you see a lot of belly fat in women or girls who are suffering from PCOS. The other thing that this increase in the androgens does is that it leads to more circulating testosterone. Okay, and this can lead to the symptoms like a male pattern baldness or abnormal facial hair and things like that in women. So essentially, these are all the things that form the entire picture of PCOS. And what we really need to do is, try and see how we can take care of all these things together, not just pop in a pill and try and cure it. It's not that easy. We will have to consider our lifestyle choices, and that is where homeopathy also plays a very, very important role, because homeopathy is the only science which takes into consideration the emotional factors behind the disease. So whenever a girl or a young woman, or for that matter anybody, comes to us for homeopathic treatment, we try and understand what could have led to this whole problem, because in front of us we are seeing the symptoms, we are seeing the expressions of the patient in terms of maybe acne, in terms of maybe abnormal facial hair growth, or hair loss, hair thinning, and so on and so forth. So we try to find out the emotional cause behind this and try to treat it. And of course, as we have experienced the cases that we have done together, we have seen that when we have put them together on a protocol where their food is managed, their exercise is taken care of, and along with that, the necessary homeopathic medicine is given, things change a lot. Drastic improvements are seen in such cases. We see that
Dr. Abhay, that's a very good point. I wanted to interrupt you there because of the insulin resistance. And that's another vicious cycle, because then the girl tends to start putting on more weight. And then they get more distressed about the weight. So the stress levels go up, further causing a hormonal imbalance. And then they start going on these fad diets where they restrict themselves from food, slowing down their metabolism and actually increasing body fat. So the important part that you brought about acne, because so many people out there have acne. Now, what are the tests that you recommend for people to check if they have PCOS? What are the symptoms you look for, and what are the kind of tests that helps you and them establish the fact that they have it?
Yeah, so basically, initially it was just thought, many a times what happens is we see that generally a girl or a woman comes with irregular periods, and in general practice, it is a tendency that we just a doctor would just write an pelvic ultrasound, which can show changes in the ovaries, cystic changes in the ovaries. But essentially, just having cystic changes is not, on the basis of that, we don't label anybody as having PCOS. We have to see the corresponding changes in the hormonal panel that we do also. So we do the testosterone levels, we do the insulin resistance, or the GTT, and all those things. And essentially, if a girl or a woman has not had periods for over 6 months and she's putting on a lot of weight, etc., that is when we should think of, or that should trigger off a question in our mind, so that we go and try and find out what exactly is happening, and not just based on one ultrasound or something like that. We don't base our diagnosis on that. We do an entire panel of tests, including the thyroid levels, including vitamin D, because again, lower vitamin D levels have in fact shown that these girls are prone to PCOS, So it is very, very important, because lower vitamin D levels also increase insulin resistance. This is scientifically proven now. And it can increase the
vitamin D, you're very right. Vitamin D is required for hormonal production in the body. It's like a precursor hormone. So if you have low vitamin D, you don't even have the ability to produce the right amount and right quality of hormones. That's a brilliant point.
Yes. And as you know now, with the lack of exercise and lack of exposure to the sun, most of us just doing jobs inside air-conditioned offices or homes and things like that, we hardly get exposed to sun, which is a natural source of vitamin D. So a lot of vitamin D deficiencies we are finding in young girls.
Right. So, Dr. Abhay, what about OCPs? I want to talk about oral contraceptives, because what happens is the doctors prescribe them. Girls and young women pop it, their skin clears up, they have quick fix results. But we all know the dangers and the side effects of OCPs that are taken for a very, very long time, right from estrogen levels to weight gain, so many other things. So what is the protocol in homeopathy? Because I know you've worked with several patients who were on OCPs, and after homeopathy, nutrition, lifestyle changes, they're off OCPs completely. with
Yes.
regular period cycles and everything else. Can you talk a little bit about OCPs and how homeopathy and what the protocol is that you take to eventually get these people off the OCP pills?
Yes, so essentially, as you know, that OC pills are given to regulate the cycle. And what happens is these are not natural hormones, these are synthetically prepared hormones which are pumped into a woman through the OC pills. So, of course, they have their side effects, and it becomes very, very difficult, in fact, to get them off the OC pill if they have been on the OC pill for a long time. We have to employ methods where we will be able to, that's where your diet and that's where detox and all these things come into play, because these kind of cases we specifically have to give them a plan where we detox their system so that their liver starts functioning better, because OC pills can create a lot of load on the liver as well. They make you prone to cervical and breast cancer. They make you prone to strokes, blood clotting. We have had cases where a long-term use of OC pills has resulted in hypertension and migraines and so many other things. So essentially what we try to do, as I said, when a person comes with PCOS, the first thing that we do is we take an entire history about her problem, about her the way in which she is managing or not being able to manage her stress levels, and of course the physical symptoms that are there. All these things are taken into consideration, and based on that we try and give her a proper plan which includes the food corrections, which includes the exercise, which includes the detox, and then putting her off the OC pills and giving her the appropriate homeopathic remedy along with that, so that within 3-4 months or so she can get her natural cycles. Because what homeopathic remedies do, in fact, they work at your energy level and they stimulate your body's natural ability to secrete the hormones or produce the hormones naturally. So we've got to allow our body to produce those hormones naturally. What happens with OC pills is the body gets lazy. Your
Yeah.
endocrine system will get lazy immediately because it's got everything ready-made. No? So we have to again teach the endocrine system to start producing its own hormones. So that can take time sometimes, but essentially we can surely do it. And that's where the role of food and the role of exercise and proper diet and sleep and all comes into play.
I think that's a good point, because everyone, usually gets, not everyone, a lot of people give up on homeopathy because they think it takes time. But then that's exactly the mechanism that's working. It's trying to retrain the body into producing it naturally. In fact, 2 days ago, I had a consult with a patient in the US, and her doctors had put her on OCPs and told her to come back for a review in about a month. But she didn't go for 3 years. And she continued taking OCPs every day for 3 years. And you can imagine the damage that was done all over. In fact, we're sending her over to you very soon once we start the nutrition. But one more thing, I get a lot of questions. There's this morning after pill, which women use, when they're having a night of, sexual intercourse and stuff like that. Now, the morning after pill, does it work like an OCP? And secondly, if a woman wants to take it maybe once in a month or twice a month, what would you, is it safe if it's done in moderation, or is it something that, you would prefer not to advise?
So, of course, I would prefer not to advise, because again, it is something which we are going to pump in synthetically, and it's kind of a bolus dose that we give to achieve the results that we want, in this case, to avoid pregnancy. So I think it's best avoided. But for those odd occasions where something might have gone wrong or something of that sort, it's okay. So occasionally taking it, or maybe once a while, if really things have gone wrong, and taking it, it's okay. But you can't do it as a habit, kind of, that will really mess up with your hormonal system and create a lot of issues, which we will find difficult to manage in the future. So
absolutely. What about the connection between hair loss and PCOD? Because a common question that we get, our testosterone levels are higher. So women actually think that because my testosterone levels are higher, I'll actually have more hair growth, which they do on their chins and lips and the side of the face, but they're losing hair on the head. So how does this work, Dr. Abhay?
So there is, again, in this, there is one important thing that we need to understand, that there is something called as the sex hormone binding globulin.
Right.
So this sex hormone binding globulin tends to drop if women have PCOS, and that is the responsibility of this sex hormone binding globulin is to carry the sex hormones to the required locations. Now what happens is, if you have got PCOS, what will naturally happen is this sex hormone binding globulin will be low, as a result of which you will have more circulating testosterone, and then
Right.
that creates lot of male pattern baldness. It will create abnormal hair growth. So this is what we have to understand. Why are we getting this? It is because of these kind of things that happen in PCOS. So it is essential that we maintain a proper balance. Otherwise, because all this is interlinked, one drops, then something else rises, and this can really lead to a hormonal havoc. So that is one of the reasons why, in fact, even what happens, a lot of women come to us with skin problems, which we call as acanthosis, or darkening of the skin, especially around the neck or in the axilla and things like that. Now again, here, and acne is one of the biggest thing that probably a woman or a young girl or a woman would come to us for. She may not be even bothered. I've seen so many girls, they're not even bothered about the regularity of the cycle. First thing that bothers them is the acne on the face
Correct.
and the acne on the back and all that. And then we have to convince them that it is very essential for you to get a proper cycle. Because what is happening, why is she getting acne, we have to understand. Because again, increase in the androgen levels will lead to enlargement of the sebaceous glands, the sweat glands. So,
Yeah.
and that leads to production of more sebum. Now more sebum means more cystic acne. So this is
Yeah.
again a vicious cycle. So that is
Yeah.
where we recommend, that you have to sweat it out, kind of. You have to exercise is going to help you to detox your system in that way. So all this is, Luke, I think it is all interlinked. So that's where the role of holistic management comes in. We have to think of this problem through all possible angles.
Right. No, that makes sense, Dr. Abhay. So when we are taking homeopathic medication, for example, when you're giving it to a patient, one is to treat the underlying emotional issue that may be there, which is obviously causing stress, and then that's the whole start of it. Can
Yes.
homeopathy, address a direct cause, like allopathy addresses a symptom? Can homeopathy actually change the hormonal balance directly, or is it through addressing the root cause of managing the emotional stress?
No, so the beauty of homeopathy is that we can do it at both levels depending on the case in hand. It's not
Interesting.
a fixed formula like in the allopathic system where we give them a fixed kind of medicine. Here,
Right.
what we try to see is try to find out the root cause and treat it. And at the same time, we can give something specific to address only the hormonal imbalance as well. So we can do it together. But the best way to do it, and as I said, depending on the case and the severity of the problem, we take a call based on that. So if it's not an urgent situation, we can go via the route where we first try and treat the root cause, and eventually everything will fall into place.
Right.
Otherwise, if the case is very urgent, or there is a situation where specific remedy is in demand, we will have to prescribe that specific remedy as well, and that works well. And the other question I think many women have is whether we can take something else together with homeopathy, and maybe can we take allopathic medications? Can I take other medicines with homeopathy? So again, as I said, it all depends on the severity of the situation. In some situations, we would allow them to take, some medicine along with our homeopathic medicine. Otherwise, if we feel that it's going to interfere with the whole process, we generally tell them to stop. But as I said, now somebody who's on a pill, we can't abruptly tell her to stop the pill from
Stop
tomorrow,
it. Yeah,
kind
you
of,
have to wean them
because it
off.
can
Yeah.
create, we have to wean them off. So that's how we address this issue.
Okay, great. So, Dr. Abhay, I always ask you this on all the calls because this is something that everyone has this scare about homeopathy. There are rumors that some people put, steroids in their homeopathic pills. And I know there are some people who do that, which is the wrong way of doing homeopathy and stuff like that. But of course, the general question is, does homeopathy have any side effects and stuff? So if you could touch on that topic, that would be great. And then I have one last question for you. Go ahead.
Yeah. So no, again, as I've been answering this question so many times, and I would do that again. Is the homeopathic medicines that we are using are, of course, there are good people and bad people everywhere, in every profession. But in general, the homeopathic medicines that are used are prepared from natural sources, so there's nothing synthetic in that. The medicines is prepared from plants, minerals, and some animal extracts, etc. And they are absolutely safe. They have been tried and tested on healthy human beings. So that is the biggest advantage. We have first-hand information about what a medicine can cause and what a medicine can cure only in homeopathy. Human trials have been the basic thing in homeopathy, whereas in any other system, the medicine first is tried on lower animals. Okay, so we have this adequate proving about the homeopathic substances that we are using. And no, absolutely not. We don't use any steroids in homeopathy. Of course, as you know, that there are certain natural substances which can have steroid-like activity, so they can bring down the inflammation fast and all that. It just reminds me of one case which recently we saw where this woman, reported that she did not have to take the anti-inflammatory post her injury. Just few homeopathic pills helped her. So this is the speed with which an accurate homeopathic remedy can work, and no, there are no steroids in it.
Okay. Great. Dr. Abhay, before we let you go, any tips, 1, 2, or 3 tips that you would give from your experience, because you keep seeing all these cases from around the world. Any top 3 tips that you would want to give, to people listening in today or people who are probably struggling with this?
Yes. So very rightly you said that a lot of women and young girls struggle with it. And what I want to tell everyone is struggle is the part of the story. So you have to believe in yourself. You have to believe that within you lies the cure for whatever problem you are suffering from. And if you align yourself with the nature, then surely there are natural ways that will help you. Okay. So don't let PCOS define you. You are beautiful as you are. So stay strong, stay beautiful, believe in yourself, and surely you will be able to overcome this problem. That's the only message that I would like to give.
All right, great, Dr. Abhay. Thank you so much. And since I have you, thank you also for treating all of our patients around the world. I mean, it's just amazing what I would never believe in homeopathy before, not because I wouldn't believe in it, because I didn't understand it. But over the last years, seeing the kind of dramatic, results you've had on cases which we work on together, we have full belief in homeopathy, the way it works and how it works. And of course, there are cases where it works and then those rare odd cases where it doesn't work. It's the same with allopathy, the same with nutrition, the same with Ayurveda. But thank you so much for your time, Dr. Abhay. Thank you. And I think the next topic that we would love to do with you is on endometriosis, because a lot of women suffering with that as well. And if not managed the right way, they move into endometrial cancers. And I would like to talk to you on endometriosis, cysts, and fibroids. So I'll set up time with your EA at some point. But thank you so much for your time. Have a great evening. And thank you, everyone, for joining in. Bye.
Thank you. Thank you. Bye. Take care.